If you're over 55 and experiencing unexplained fatigue, memory, fog, or strange tingling sensations, you might be facing a silent health crisis that millions of people ignore until it's almost too late. I'm about to share something that could completely change how you think about your health after 55. And if you've been blaming these symptoms on just getting older, you need to hear this. You know that feeling when you wake up tired, even after a full night's sleep, or when you walk into a room and completely forget why you went there? Maybe you've noticed your balance isn't quite what it used to be, or your hands and feet feel strangely numb sometimes. Most people over 55 experience these things and think, well, this is just part of aging. But what if I told you that these aren't necessarily signs of getting older at all? Here's the thing that most people don't realize. Your body has been quietly struggling with something for months, maybe even years. And by the time you notice the symptoms, you're already deep into a deficiency that's affecting every cell in your body. The problem is, we've been taught to accept these changes as inevitable. We brush off the fatigue, the memory issues, the strange sensations. We tell ourselves it's normal, but there's a crucial nutrient that your body desperately needs more of after 55. And when you don't get enough, your entire nervous system starts to break down slowly, quietly, without you even realizing it's happening. I want you to think about your stomach for a moment, not the part you can see, but the intricate lining inside. After decades of life, this lining starts to change. It becomes less efficient at producing something called intrinsic factor. Now, intrinsic factor might sound like medical jargon, but it's actually your body's key to unlocking one of the most important nutrients you'll ever need. Without it, you can eat all the right foods, take all the supplements you want, and still become deficient. This is why vitamin B12 deficiency is so common after 55. Your body literally loses the ability to absorb it properly. And here's what's really concerning. The symptoms develop so gradually that most people don't connect them to a simple vitamin deficiency. Let me walk you through what's really happening inside your body when B12 levels start to drop. Your nerve cells, the ones responsible for everything from your memory to your balance, they're covered in a protective sheath called myelin. Think of it like the insulation around an electrical wire. When B12 levels fall, this protective covering starts to deteriorate. Messages between your brain and body become fuzzy, delayed, or lost entirely. It's like trying to make a phone call with a damaged wire. Sometimes the connection works, sometimes it doesn't. The first sign most people notice is the fatigue. But this isn't ordinary tiredness. It's a deep, bone-deep exhaustion that sleep doesn't fix. You might sleep for 8 hours and still feel like you haven't rested at all. This happens because B12 is essential for making healthy red blood cells. Without enough B12, your blood cells become large and they can't carry oxygen efficiently throughout your body. So every cell, every organ, every tissue is getting less oxygen than it needs. Then comes the memory fog. You might find yourself struggling to remember names, losing track of conversations, or feeling like your mind is wrapped in cotton. This isn't dementia, though it can feel frighteningly similar. Your brain uses more energy than any other organ in your body. When it's not getting enough oxygen due to B12 deficiency, cognitive function is one of the first things to suffer. The scarier part, this can happen years before any blood test shows a problem. But perhaps the most unsettling symptom is the numbness and tingling. It often starts in your hands and feet, like pins and needles that won't go away. Some people describe it as feeling like they're wearing thick gloves or socks all the time. This happens because those nerve coverings I mentioned earlier are breaking down. The signals from your extremities to your brain become garbled. Touch doesn't feel quite right. Temperature sensations become dulled. Balance becomes uncertain. Here's something that might surprise you. Many people with B12 deficiency also experience mood changes that seem to come out of nowhere. Depression, anxiety, irritability. These aren't just part of getting older either, that your brain needs B12 to produce neurotransmitters like serotonin and dopamine. These are the chemicals that regulate mood, motivation, and feelings of well-being. Without adequate B12, your brain literally can't make enough of these crucial compounds. Now, you might be thinking, okay, but I eat meat, I take a multivitamin. Surely I'm getting enough B12. And that's exactly what makes this so insidious. You can be doing everything right nutritionally and still become deficient. The truth is, as we age, our bodies require more B12, not less. But our ability to absorb it decreases dramatically. It's like trying to fill a bucket with a bigger hole in the bottom every year. Some medications make this worse. Proton pump inhibitors for acid reflux, metformin for diabetes, even some antibiotics can interfere with B12 absorption. If you're taking any of these, your risk increases significantly. But here's the most important thing I want you to understand. The damage from B12 deficiency isn't always reversible. Those nerve coverings I talked about, if they're damaged for too long, they might not fully repair, even with treatment. This is why recognizing these signs early is so crucial. The fatigue, the memory issues, the tingling. These aren't just inconveniences. They're your body's desperate attempt to tell you something is wrong. The good news, when caught early, B12 deficiency is completely treatable. I've seen people transform their energy levels, clear their mental fog, and regain their zest for life, all by addressing this one deficiency. But it requires more than just taking an over-the-counter supplement, since absorption is the problem. Many people need B12 injections or high-dose sublingual supplements to bypass the digestive system entirely. So here's what I want you to take away from this. If you're over 55 and experiencing any combination of these symptoms, persistento fatigue, memory problems, numbness or tingling, mood changes, or balance issues, don't just accept them as part of aging. These could be your body's way of asking for help, and the help might be simpler than you think. The next time you see your doctor, ask specifically about B12 testing. Not just the standard test, but the more sensitive markers like methylmalonic acid and homocysteine. These can detect deficiency before it shows up on regular blood work. Your body has carried you this far. It deserves to feel strong, energetic, and clear-minded for all the years ahead. Don't let a simple vitamin deficiency steal your vitality when the solution might be within reach. If this opened your eyes to something you hadn't considered before, hit that subscribe button and I'll keep sharing insights that could change your health journey.